So to me, we certainly were surprised how many people were coming to Sesame for weight loss. But in retrospect, I think we were wrong to be surprised. Like, it's pretty obvious. When there's an effective medical treatment for something that is of major concern to somebody's life, obesity, sleep, another one, it only makes sense that people are going to take that path if it's available to them. So I'd expect to see this continue. And I think more things will go down this path over time too.
New choices, new players, new models of care. You know, consumer first healthcare is everywhere. For us to build the future, to see what's new, we gotta look at the world from a different point of view. Consumer innovation ain't going away. I say it's here to stay. Today it leads the way. We gotta drop the silos. We're all the same team. Experience, business, tech, and marketing. So join us now. Join the revolution. Consumer first health is the evolution. Status quo or like status no. Yeah, this is the healthcare rap. Yo, come on, let's go.
Welcome back to the leading podcast for consumer experience champions in healthcare. This is episode 335. I'm Jared Johnson, and here's what's going to go down today. We have the Flava of the week about Walgreens scaling back its investment in VillageMD and in healthcare in general. Will the future of retail health trend towards partnerships? And will scaling up quickly make sense for anyone after Walgreens' latest earnings call? I'll talk about that. Then season 11 marches on with Michael Botta, president and co-founder of Sesame. You'll hear about Sesame's partnership with Costco, some details about the recently announced weight loss program, and what it all tells us about how consumers view their health and wellness and where digital health fits in. It's time to dive right in. Are you ready? Let's go.
Flava of the week.
Another week, another household name pulling back its investment in healthcare. Do you ever stop and reminisce about the glory days of retail health? That's a bit of a trick question because I'm not sure we ever really got to the destination we were all promised. You know, the panacea of convenience and price transparency that would fill care gaps and increase access without requiring traditional health systems to bear the responsibility and find a way to pay for it? No, the ones paying for it were Fortune 50 companies, and their demise has returned us full circle to the mantra of healthcare is hard. Remember, it was the scale of that vision that drew headlines and haters, which is why Walgreens' June earnings call was such a letdown again. According to Forbes' Bruce Japson, Walgreens Boots Alliance is looking to reduce its investment in the doctor-staffed clinic operator VillageMD after billions of dollars in losses and the need to focus on more profitable ventures to turn around the drugstore chain. The company will remain an investor and partner, but is working with VillageMD's management toward an endpoint. Walgreens invested more than $6 billion in VillageMD under former chief executive Roz Brewer to take a controlling stake, but the company's already scaled back dramatically on the expansion of doctor practices and clinics the company opened attached to Walgreens. In 2020, Walgreens said it planned to open 500 to 700 Village Medical at Walgreens clinics in more than 30 U.S. markets over 5 years, with the intent to build hundreds more thereafter. But the investment hasn't gone well. Walgreens' total operating loss for the first 9 months of fiscal 2024 has grown to $13.1 billion. Earlier this year, Walgreens said that VillageMD had slowed the number of clinic openings in part because their operators haven't been able to fill their patient panels. So again, what a bummer. To some, it might seem like the new best case is that retailers stay in the game but at a fraction of the scale, and therefore their collective impact on access and affordability is minimized to the point where the existential threat to health systems is pretty much gone. But I would say don't forget the players who are still on the board, namely Amazon, CVS, Best Buy, the new wave of grocery chains and fitness brands coming into the space, and other big box retailers that are launching new offerings through digital health partnerships. You're about to hear from one of them in a moment, and they won't be the last. Because the reality is that there's still a lot of money to be spent on patient care, and there are plenty of players still wanting their piece of that $4.5 trillion pie. Let's see if the future of retail health will continue to trend towards partnerships and whether scaling up quickly makes sense for anyone after Walgreens' latest misstep. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the week. All right, everyone, let's get into the flow. It is time to welcome Michael Botta. He's the president and co-founder of Sesame. Today, we're going to talk about Sesame's partnership with Costco, some details about their recently announced weight loss program, and what it all tells us about how consumers view their health and wellness. Where does digital health fit in? And Zaina, what do you hope to hear about or want to learn about today?
I think for me, I would love to learn about to the degree Michael can share, like numbers, like what does the uptake look like around direct-to-consumer health? I know we had Real Health CEO on here not too long ago, and she made some interesting statements that direct-to-consumer healthcare is actually growing, and some of the numbers that have been produced may not capture everything since they're not related to claims. And so I'm hoping to hear that. I'm hoping to look under the hood, so to speak, and maybe hear a different narrative than what mainstream digital health news is reporting, but we'll see.
Perfect. Well, with that, let's find out where we get to in this conversation. Michael, welcome to Healthcare Wrap.
Thanks for having me, guys. I appreciate it.
Can you give us the boiled down version, like the 2-minute version of who you are and what you do?
Sure. So Sesame is a two-sided healthcare marketplace. We work with thousands of clinicians across the country, so in all 50 states. And these are all sort of independent practitioners, so physicians, labs, imaging centers, you name it, that have their own practices running and want to list some of their services or all of their services on Sesame to build out another revenue source, another stream of income, another way to acquire patients into their practice. And on the consumer side, we are really the place to go if you care about how much your healthcare costs. And so for us, our major customers are folks with high deductible health insurance. That's sort of the bulk of who uses Sesame, as well as people who either don't have insurance or want to pay cash for other reasons. But the idea was really, as we saw, post Affordable Care Act, more and more Americans had access to health insurance, but what it means to be insured has changed a lot. So the number of people that have deductibles and the level of those deductibles have gone up pretty remarkably over the last decade or so. And we've given people this theoretical incentive to shop around for care and to get the best price they can because it's fundamentally their money coming out of the deductible. But we didn't really give them a good way to do that. So Sesame is the good way to do that. That's really the idea. And sometimes people will say like, oh,
that's awesome.
But what about those people who exceed their deductible? Do they care anymore? And I would say is if you actually look into the numbers, for people that have a high deductible plan, it's about 4 out of 5 of them in a given year don't actually reach their deductible. So the vast majority of people in high deductible plans, they're really spending their own money on the vast majority of care they receive. We're trying to be the way to do that, and to have some orientation towards value. So to know what something's going to cost, pay it up front, lock in a discounted price.
I like that. I think that's a really interesting insight. Can I ask you, Michael, how did you come up with that name? Like, where did Sesame come from?
I wish I could tell you there was like a brilliant story about it. I think my co-founder has a great fake story that he'll tell, which is that, we were sitting around thinking about how we would structure the website. And we were like, well, maybe we'll have a login blocker up front. And once you click through the login, it'll be like open Sesame and you can see all this stuff. And it was like, oh, Sesame, that's our idea. But I don't think that's really true. I think we were just looking for like, what could we get a trademark on? What would sound like be simple, whatever the good domain name, stuff like that.
Nice. Well, hopefully it's not a knock. But when I first heard of Sesame, I thought of Sesame Street right away. And then when I navigated to your website, I just got the feeling like it's very approachable. Like your digital front door is very good. And it kind of reminds me of the kids show. I got warm and fuzzy feeling.
Oh, I mean, to me, that's a huge compliment. My 2 kids are like the biggest Sesame Street fans in the world. So I'll take it.
Let's dive into a couple of recent announcements. I think it's been around 9 months since Sesame first partnered with Costco to offer primary care. I think it was September 2023.
I know it to the day because it was the day before my second child was born. So I can like remember where we were when we did the announcement. We were like in the delivery room. So yes, so it's about to be 9 months because she's about to be 9 months old.
That's fantastic. Well, tell us kind of like some of the early returns. How is that partnership going? And for those who aren't familiar with it, do we want to describe kind of what the partnership involves and kind of, some successes that you've had so far?
Sure. So for Costco members nationwide, they get access to preferential pricing on the Sesame platform, sort of across the board, but with a particular focus on things like primary care services, mental health visits, and some lab services that are available in different parts of the country. And then incrementally, we've been launching specific sort of verticals that are of great interest to Costco members. And the first of those has been around medically assisted weight loss, which we've been thrilled to do. A, with Costco as a great partner. B, I think there's been a lot of attention paid to it because the idea of Costco being involved in this space drew a lot of attention, a lot of media. So did a ton of sort of communications maybe we wouldn't otherwise have done as a result of the partnership. But they've been great partners to work with. And the idea there is that Costco members can come to Sesame to get our best pricing on finding a clinician and scoping out if medically assisted weight loss, if something like a medication that can help them if they're obese or overweight is right for them. And if so, can get great pricing with manufacturer savings cards on prescriptions of those medications. Again, if they're appropriate. It's not going to be appropriate for everybody. Like people come in sometimes, they just want to lose like the last 10 pounds after having a baby. I'm going to say like, that's not really what it's for. It's not going to get you like a prescription for this genuine medication. But for the folks, and there are millions upon millions of Americans who really struggle with obesity and who are hearing about some of the things that are possible now with some of the newer treatments on the market. So being able to help those folks in an affordable way is one of the biggest things we're doing right now with this Costco partnership, and hope to continue it. So it's been a blast so far.
How does that work? So I've been researching it a little bit. So it's offered on Costco's site. So you can start there in terms of how to actually get to the point where you've signed up for services. What does that journey look like for somebody who is exploring this and ultimately decides to try it out?
Yeah. So if you come from Costco, you're going to confirm your membership number when they pass you over to Sesame. And on the Sesame site, you can choose from among clinicians who are licensed in your state, pick the clinician that you think is the best fit for you. You then get discount off of the total service charge for having a Costco membership. It's just like everything else Costco does. They drive a hard bargain. So Costco members get the best prices on all kinds of things. And then you'll see a doctor. That doctor is going to do a live one-on-one visit with you. They'll walk through things like your weight, any comorbid conditions, history of weight loss attempts, what you've tried, allergies, any contraindications, and then walk through, if it's appropriate for you, prescribing a course of therapy to help you manage weight loss. That might be a GLP-1 like Wegovy or Zepbound. Could be other things depending on what you need, where you are in your journey. And then that gets prescribed, and then you can choose to use your insurance to pay for the med, or you can, if you're going to pay out of pocket, use something like a manufacturer savings card to get a discount at the retail pharmacy setting. And you can pick it up at a Costco pharmacy. You can pick it up at another retail pharmacy. You have mail order options or a range of options. For the most part, the biggest challenge for folks right now is finding supply, because GLP-1s have been just incredibly popular. So finding a local retail pharmacy to make a pickup, that can be the hardest part. But we get you on the right path with a clinician that you choose that's going to be hopefully culturally relevant to you, speaks the same language, can understand where you're coming from, and has meaningful experience in managing patients on medically assisted weight loss.
I read a story about how weight loss became one of those initial deeper dive services that came about when the Costco side and the Sesame side were looking at like what are people searching for up on the website, and weight loss was just by far and away number one thing. And, it's led to a discussion between us about, do consumers kind of see health and wellness more together than maybe a traditional, health system might think, in that, they're shopping for service line XYZ from a doctor, versus consumers just seem to look at health and wellness a lot closer together, like all related. These are the things that I want to help me feel well. I don't know if that's accurate, but it was leading us to have that conversation. What's your take on just like what insights you were gaining about how consumers view healthcare? It's
a really good question. And I think that for so long, weight loss has really been a consumer industry as opposed to a medicalized service. It's sort of a truism, but I do think it's true. Like, the more successful we are in medicine, the more almost everything becomes medicalized. Like, we find treatments or therapies that can improve all kinds of things that we didn't think were treatable before. And weight loss is the newest of those. So whereas historically, I think there's something like $80 billion in annual consumer spending towards weight loss. Now, all of a sudden, whether it's the media attention, whether it's direct to consumer marketing, whether it's just people, being up on FDA approvals, probably not that one. There's this understanding that you can go to your doctor and, if it's appropriate for you, get prescribed something that can make a meaningful impact on something that you might have struggled with your entire life. So I think that this is one example of something moving from the realm of wellness or maybe over into the realm of medicine more directly. It's not true of everything. It'll be interesting. I know that there are trials ongoing for sleep apnea, so for obstructive sleep apnea for these medications. And that's another area of healthcare that sort of bridges the gap, where historically that's a huge consumer industry in part, where people spend lots of money on hypoallergenic mattresses. There's a company, 8 Sleep, that charges an arm and a leg for what looks like a really cool product that I personally do not have in my house, but it looks pretty great, to help you sleep better. But then there are also lots of folks, there's a board certification in sleep medicine. There are sleep studies that people do. They get diagnosed with obstructive sleep apnea. They use a CPAP or a BiPAP machine. Those are all sort of on the medical path towards diagnosis and treatment. That's one that, with the data from that, I think it's the Surmount trial that came out, at least the first readout of it came out in the New England Journal last week or so. It's really interesting to see that. Like, I'm sure that when Lilly files for FDA approval, all of a sudden there will be much more attention on sleep. Again, this thing that historically very much a consumer industry becoming part of the healthcare system. So will you see coverage for these drugs for sleep apnea? I bet you will, and in many cases. So to me, we certainly were surprised how many people were coming to Sesame for weight loss. But in retrospect, I think we were wrong to be surprised. Like, it's pretty obvious. When there's an effective medical treatment for something that is of major concern to somebody's life, obesity, sleep, another one, it only makes sense that people are going to take that path if it's available to them. So I'd expect to see this continue, and I think more things will go down this path over time too.
Interesting. I've recently been involved in a digital health poll that we put out, believe it or not, in South Carolina. And the number one service that South Carolinians were looking for was behavioral health, go figure, and then weight loss and metabolic health. And so not surprised. And then maybe just anecdotally, recently it's come to my attention just how many people in my own friend circle and network really just struggle with sleeping. Like, people aren't sleeping anymore for whatever reason. And so I'm not surprised that these drugs would come out and that ultimately Sesame could be a pathway for people to access these remedies.
I think in general, part of our thesis was, and I'm a healthcare nerd by training and education. So like really thinking back and, way back, there wasn't much we could do for you in the healthcare industry. Hospitals were places people went to die. And, with the advent of antibiotics, with the advent of effective surgeries, all of a sudden more and more things became medicalized. And that trend only continues. So we're in this world where we created a health insurance system that assumed that uses of the healthcare system were going to be relatively rare. So we have this insurance that's set up with this structure where, we'll pay for big events, but they'll be relatively uncommon. But then all of a sudden we've got, the modern world where there are all kinds of things that in theory can be covered by your healthcare benefit. But all of a sudden then the idea of using it as insurance sort of breaks down. Like, you don't use your car insurance to get an oil change, because if you did, your car insurance would be a lot more expensive because there'd be all this routine preventable stuff in there. We've got these new treatments. We've got GLP-1s. We've got a huge variety of things coming over the next several years, whether it's immunotherapy, gene therapy, you name it, things that are going to be really high cost and they're going to have a meaningful impact on quality of life, maybe life outcomes. And we have this really antiquated health insurance system that doesn't really account for most of these things. So part of our thesis in building out Sesame was there's going to be a need for a direct consumer angle for many of the things we do. And I think whether it's consumers motivating that, whether it's pharma companies looking for partnerships to say, hey, we need a channel where we can connect patients to clinicians who understand how these new cutting edge therapies actually work. Those are all things that I think this platform can help with. And our marketplace structure is designed to both, vet clinicians, make sure there are reputable folks on the platform, but then to help clinicians differentiate themselves by building expertise and promoting that expertise in therapeutic areas where it makes sense.
Yeah, that makes a lot of sense. Maybe just one more anecdote on the topic of sleep. I'm noticing a lot of bros in my network who are big into weightlifting, amongst the fitness influencer community. There's this new attention focused around how important sleep is to building muscle and recovery. And so I've noticed just a number of folks who I never would have thought would care about their sleep suddenly care, because now they see the science is connected to their broader fitness journey. And I think, to your point, that trend's only going to continue.
That's become true. The more people are focused on longevity, I think about what Brian Johnson is doing, the former, I think, Braintree founder. And you realize so much of it boils down to are you managing stress? Are you getting enough sleep? Are you eating appropriately? Beyond that, everything else is sort of marginal, but sleep makes a big difference.
Totally. Michael, wanted to ask maybe a couple of questions wrapped into one, but the first simple question is at any point, do you all offer your own services, or are you truly a platform and marketplace? And then to follow along with that, so much of what Jared and I have talked about over the years is this notion of design in healthcare as a means to engage people, making technology that works, that's simple, that's intuitive. Curious how you all think about design and engagement principles in building Sesame to make it easy, from a user interface and interaction perspective, to actually connect people to the right services they're looking for.
For the first question, my perspective is no, we're not looking to sort of employ physicians as providers. We employ physicians here as advisors to help us craft guidelines and think through strategy about what service offerings make sense, whether they're on the telehealth side of the business or the in-person care side of the business. But we like the idea that we're not competing with the clinicians on the platform. They are building their own practices using this infrastructure. And then on the second piece of that, I like to think of Sesame as being a design and product-led company. So the way we do this is by hiring great designers and great product leaders, having them talk to our customers who are both the patients who use Sesame and the clinicians who are listing their practice on the platform, and to be users of the product. So we want everybody using this product to find care, to identify things that make sense, things that don't make sense. Our CTO yesterday was posting about how it was less intuitive than he expected to message a provider for follow-up care. Like you can have ongoing messaging with the provider you've selected for a video visit. He was trying to send his provider a follow-up message. He realized like, oh yeah, it's sort of hidden compared to where I expected it to be. So we can do that better. And I think that everybody having that eye towards the design of the experience is really important, because fundamentally, like so much of healthcare has really wonky design. Like it hasn't really been thought about with design in mind. But this is a direct-to-consumer platform. So it's really important to us to look like the rest of the internet, where things make sense or else your business doesn't exist.
I think Jared and I are both more or less, digital health consultants for our day job. And, there's something we preach on daily is it's one thing to just functionally have the capability to do telehealth or to schedule, but it's entirely another thing to build that seamless process that's informed by design, right? And, if you monkey around on some health system websites, it's like, you could probably pay file your own income taxes easier than you could to schedule some appointments of these health systems out there.
And don't get me wrong, I think being a co-founder of a company, you can always point to all the things you wish you did better. Like there are a million things in the experience. I'm like, oh, we can improve this, we can improve that. But it's also a matter of picking our battles and prioritizing the things that get the most usage and attention to make sure those are as good as possible.
And then what about on the provider side? So for, providers or whoever it might be that's connected to the platform, is it your platform for, let's use maybe virtual visits as a use case? Are they using your platform to facilitate the virtual visit, or does your platform connect them to whatever platform they're using? What does that look like?
Yeah. So when we first started, it was sort of open to any platform. So you could use us and then navigate to your own platform if you wanted to. And what we found was that clinicians actually really valued creating a standardized experience where they could have the intake form from a patient, have their clinical documentation all in one place. So we really built that. We built our own bespoke telehealth platform that can transition a patient from in-person visits to telehealth and vice versa on our infrastructure. So that's what almost everybody uses now. Not everybody, there are plenty of folks who are grandfathered in who still have a solution that they started with, they're still using. But the vast majority of clinicians who have signed up on Sesame since 2020 use the Sesame infrastructure to conduct their visits and to do things like asynchronous messaging with a patient after the visit's over.
That's fantastic. And I guess how are you attracting more providers to your system? How do you reach out, or what's the value proposition that you communicate to them?
Yeah. It's really different now than it was when we first started. When we first started, I was on planes all the time. I was a former McKinsey guy. I was in consulting for a long time before we started the company. And so I was really used to getting on a plane to take a meeting. And so I was flying around to Kansas City, Oklahoma City, Houston, parts of Florida, you name it, to meet practices, to explain what we were doing and to explain to them why they should list some of their services on this platform. Over the course of the pandemic, or especially at the beginning of it, you had all of these practices who had tons of supply, clinicians were available, but patients didn't want to go to a doctor's office. You didn't really want to be in a waiting room if you could avoid it, because, we were told we had to quarantine, we had to stay, especially a waiting room, a place full of sick people, you didn't really want to be there. So we had clinicians reaching out to us to say, hey, can I list my practice on Sesame and use your telehealth structure to see my existing patients, even just for continuity of care? So we built the infrastructure to do credential verification, licensure verification, credentialing. And we built out a pretty long wait list, actually, of clinicians who reached out to us to say, I want to list my practice on Sesame. So if anything, we spent the last couple of years working really hard to build out a really smooth process to get people credentialed and listed if we were confident with them being on the platform. We have a team here as well that does nothing but clinician recruiting when and where we need it, in certain states, if we want to increase the supply of clinicians, the availability of clinicians on the platform. But for the most part, we've had a pretty robust intake process of people reaching out to us to say, I get what you're doing. I want to build a cash pay business as part of my practice. I want to have some patients that I'm managing for a monthly fee or maybe fee for service on the cash pay side. So clinicians have come to us all over the country to list their practices on Sesame.
Michael, what can you tell us about what's coming in the next 6 to 12 months, where Sesame's focusing?
we're always looking to make it easier and more straightforward for great clinicians to list their practice on Sesame. It's free for them. So we're not charging clinicians to use this platform. So we've got a pretty strong pipeline. We'll look to keep making that easier and more efficient, keep increasing the amount of tools that are available for a practice to be effective and to make money through the Sesame platform. On the patient side, I think a big priority for us is to make it easier for clinicians to longitudinally manage a patient on Sesame. So we have people come in for their first visit and then say, great, I want to keep seeing that doctor. How do I make this my doctor? I think about how many pharma ads on TV say, speak to your doctor about whatever. And you realize it's actually sort of increasingly rare that people have a doctor in the first place. So when I think about what I want us to be able to do at Sesame, I want to make it more affordable for more people to have their go-to, like a doctor that they trust, that is managing their care, that has a holistic view of their labs, their imaging, their medical history. And we want the place to do that to be Sesame. So we're continuing to do more in that space, continuing to do more with self-insured employers to integrate the Sesame offering with what they give to their employees. I think together, we want to make this place, like I mentioned when we started, so the first place that you go if you care how much your healthcare costs, because it's fundamentally more affordable. You know about the quality of what you're going to receive because you've got all kinds of quality information at your fingertips. And it's really accessible because you can schedule, pay up front, and eventually apply that towards your deductible and make use of that spending where you need it.
Wow. Well, okay, yeah. A lot going on here in the next few months. That's exciting.
Yeah. It's definitely like we've always been pretty ambitious in like what we want this platform to be. I think we continue to do that. I'm thrilled to help people with weight loss because it touches so many lives, but it's just a part of what we do here. And we're excited to expose more people to what they can do on Sesame who maybe came in the door for weight loss in the first place.
One reason that we have this podcast is we do like to hear just some of the innovation that's happening in the industry. And sometimes that's what gives us hope for the future of healthcare. So what gives you hope for the future of healthcare in our country, where things are going?
So much of it is around the advances in medical research that we are seeing. My mom has a relatively rare disease, and to watch the progress that has been made in that therapeutic area over the last even like 3 years is like real reason for hope for us and our family, and hope for so many millions of Americans, because when you add up all the different rare diseases, it's not so rare anymore. And so to see progress being made across all these different therapeutic areas, whether it's cancer, immunologic diseases, inflammatory diseases, you name it, there's so much progress. And yeah, our healthcare system is pretty old. It's pretty antiquated. It doesn't really take into account that stuff, but it's going to have to, because we're getting all of this incredible innovation that's extending lives, helping people live healthier, higher quality lives. So that's what's really inspiring to me. Like, we're forcing change just by making really effective new therapies that can help people live longer and better.
Love that. Love that. Michael, it's been an absolute pleasure. We are benefited when we hear about the innovation that's happening out there. So we also love to ask our guests who they would recommend to come on a future episode. If there's somebody you could pick for us to be a guest on an upcoming episode, who would that be?
So I think some of the interesting people, if you really wanted to go for something outside the box, Jan LeCun is this engineer at Facebook who's one of the godfathers of AI. And I know he's advising some healthcare AI startups. It'd be really interesting to hear his perspective on, seeing what large language models are doing and some of the initial use cases people have jumped onto, things like, real-time documentation and generating a visit summary and outputs. Like, that's a big category. People are doing lots of things, but I'd be really interested to pick his brain as somebody who really understands the current state of generative AI and various forms of AI tools, to say, like, what's next? What are some of the interesting things to expect in healthcare down the line?
Love that. See, this is why we ask. I love out of the box stuff. So that's perfect. Zane, any final thoughts?
I'm thinking here I might need to use Sesame. So I'm one of those persons with a high deductible plan, and it's really hard to get in to see my own physician. And to your point, I'm paying for it anyway. And so after this call, I might have to create an account, see what's available in the Detroit metropolitan region.
Come check it out. When my wife and I started having kids, we realized even if we have pretty generous health insurance, sometimes you just really want to be able to talk to a pediatrician like today. And so having the platform to do that, whether it's for value or for convenience, it's gone a long way for us. So I know it helps a lot of people.
It's wonderful.
It's awesome. Well, and that is actually a wrap for this episode. So we want to thank you so much for giving us a lot to think about. And it's been an absolute pleasure to speak with Michael Botta from Sesame. Thanks for joining us today.
Thank you.